This is Dr. Gibson, and we're always encouraging you to try naturopathy. And I'm going to talk to you a little bit today about magnesium. It's a mineral, and it impacts over 300 different enzymes inside your body. Magnesium is used to build bone, to produce energy, and to synthesize proteins. It doesn't stop there. It also prevents an array of cardiovascular disorders. And we have clinical research that might be of interest to you. So all you need to do to have us send you that clinical research is just tell us that you want it. And so you info at trynaturopathy.com, and in the subject line, I want the information, the clinical research on magnesium as a heart beneficiary. Dietary surveys have shown that deficient intake of magnesium is epidemic in the United States. Data from the National Health Nutrition Examination Survey shows that 48% of all Americans have all ages have intake below the average requirement, which is significantly less than what you really need. Inadequate magnesium levels have been linked with an increased risk for cardiovascular disease, including We're back. Inadequate magnesium levels have been linked with an increased risk for cardiovascular disease, including stroke, coronary heart disease, heart failure, arrhythmias, and death. And again, we'll be glad to send you the clinical research that explains all of that. Higher blood levels of magnesium are associated with a lower cardiovascular disease risk. So, do you realize magnesium is inexpensive to buy? I mean, it's really, really easy. It's found in foods, leafy vegetables, whole grains, beans, nuts, yogurt, and fish. I'm cheating off some of the notes I took earlier. But truthfully, it's difficult to get and absorb enough from dietary sources alone. Approximately 64% of all men and 67% of women have inadequate dietary intake of magnesium. Above those age 71, 81% of men and 82% of women have inadequate dietary intake of magnesium. And that's a serious problem. It's involved in the metabolic functions. It means that a myriad of the bodily systems and functions depend on an adequate magnesium and suffer when deficiency occurs. It's especially important in healthy and efficient function of the heart muscle and blood vessels. Remember I told you about these studies? We have them available to you, and all you need to do is info at trynaturopathy.com, and we'll be glad to give you the studies. They've actually shown that you can correct an arrhythmia with a proper readjustment of your magnesium levels. It'll actually improve your endothelial dysfunction, and that's when the cell linings and the blood vessels lose normal healthy function. And so, why would you not do this? So this is the research. In a randomized controlled human trial, women aged 40 to 65, all of whom who had high blood pressure and were on diuretic therapy, took either a placebo of 600 milligrams of magnesium daily or placebo. After 6 months, those taking magnesium had significantly improved endothelial function, leading to reductions in blood pressure and increased blood vessel dilation. Systolic blood pressure fell on average from 144 to 134, and diastolic decreased from 88 to 81. These are major changes, and the research is there. Now, you understand why heart failure occurs. When the heart doesn't pump enough blood to meet the body's needs. There are about 6.2 million adults in the United States with heart failure. In one study of 22 patients of symptomatic chronic heart failure, an 800 milligram dose of magnesium for 3 months produced a significant increase in arterial compliance. It's a measure of how well an artery can relax and contract in response to the blood flow. And this suggests that improved endothelial function and improved ability of the arteries to deliver oxygen rich to the blood targets. We're back. Blood levels of magnesium are also strongly associated with cardiovascular risk. The risk of heart failure declines steadily with rising magnesium levels. So here's what you need to know. Magnesium is a mineral needed for at least 300 enzymes throughout the body to perform their metabolic functions. Human studies confirm there's a strong association between low magnesium levels and higher risks of cardiovascular disease. Almost half of Americans of all ages are below the estimated average requirement of magnesium. Human studies demonstrate that taking oral magnesium helps ward off cardiovascular problems and supports overall health. There's what you need to know. And I am Dr. Stephen Gibson, a naturopath. A traditional naturopath is not really so excited about the process of wellness. Hey, hold on just a minute. Kill it.